Today I bring you a case about a broken rib. In today's video, we'll analyze a case of a patient who suffered a broken rib and, as a consequence of it, was having a lot of pain. Obviously, this is one of those cases where acupuncture won't actually heal the rib. What we will do is help the patient have less pain during the process and give them a better recovery and also more quality of life during the recovery process. This is very important for a number of reasons. First of all, there are a lot of patients who can't take medication for the pain because they have kidney or liver issues. There are a lot of patients who don't want the medication because of the possible side effects. And with acupuncture, we can help all of those cases. Treating the pain is important not only for the comfort of the patient, but also for their health. As we know, pain can bring a lot of problems such as anxiety and depression, and particularly pain in the area of the ribs can make the patient do an insufficient breathing motion because they're trying to avoid the pain, and this can actually bring oxygenation and also lung problems. So acupuncture will help in all of this. If you want to learn more about the techniques I talk about in my videos, check out the links below where you can see all the online courses I have available for you. I have acupuncture courses in English and in Portuguese. Just check them out. So let's analyze this particular case. This was a 72-year-old female, and as a consequence of a fall, she broke 2 ribs. This was on her right side, and she complained about pain, mainly in the area of the breast, going from the nipple line all the way to the side. Usually in cases like this, my first strategy is to use the balance method. But in a case like this, we have to be mindful about the channels that are going through the area we're treating. So what channels do we have involved in a situation like this? Well, we have the stomach channel, but we also have the spleen channel, so stomach and spleen, and the gallbladder channels. So in this case we'll have to treat 3 separate channels: spleen, stomach and gallbladder, and of course the space between these channels. So what I decided to do was use first the triple warmer channel, which will balance both spleen and gallbladder, and the large intestine channel to balance stomach. And as I told you, we have to treat the space between the channels, so I will also work between the channels of triple warmer and large intestine. The image I chose for this situation was a direct image, so if you want to imagine you have your arm here, we have here the neckline, and we have along the elbow the line of the navel. So we will be working here in the upper third of the arm. So as I told you, we are working with the triple warmer and with the large intestine channels. And what I will do is, along this area, search for acupoints along the triple warmer, search for acupoints along the large intestine channel, and also search for acupoints between the channels, and needle every acupoint I can find. Just as a reminder, with the relationships we're using, we have to work opposite side. So if the pain here is on the right side, we're working on the left arm. Never forget that. That is a very important part. It is very important for the balance method treatment to work, according to which system you're using, you need to be working either on one side or the other of the body, and a lot of times that's the mistake that makes your treatment not work. After needling all the acupoints I could find, the patient felt a lot of relief from the pain, but there was still pain, mainly in the area of the breast. And for this, I decided to use one master tongue point, which is not traditionally used for pain, but that can give you a lot of great results. This point is 1114 or Ji Sanjong. You can find this point on the F line of the ring finger, and it is a set of 3 needles along the F line. This point is traditionally indicated for swelling of the breast, but you can also use it for pain in that area, and it has great results. I also used it opposite side, so again on the left arm. After the treatment, the patient felt a lot of relief. The pain without moving was practically zero, and even with movement, the pain was tolerable. In a case like this, where you have something actually broken, it is very hard to predict how long our results will work from the balance method. So, we decided that we would not schedule the next session in advance, but the patient would call me as soon as she felt the first sign that the pain was coming back, and we would schedule from it. What ended up happening was, in the first 4 sessions, we were working more or less twice a week, so the relief from the pain would last about 3 to 4 days, and then we would do a new session. As time went on, the patient started feeling better, and the interval between sessions went to 7 to 9 days. We worked together for about a month and a half, and after that, the patient had almost no more pain. As I told you in the beginning, this is one of those cases where acupuncture is actually not working for a cure, but just to give comfort to the patient. But this should not make us work any less hard. It is very important to treat pain and to help the patients feel more comfortable as they recover from injuries, even if we are not treating the injury itself. Thanks for watching. If you like this video, don't forget to like and subscribe. Also, help us by sharing the video and letting everyone around you know how effective acupuncture can be and how it can help them in their lives.